Hello class, we're going to look at general survey, which is in topic 1. So the general survey is a study of the whole person. It covers general health state and any obvious physical characteristic. An introduction for physical examination that will follow should give an overall impression, a gist out of person. Objective parameters are used to form general survey. These apply to whole person, not just one body system. And the general survey starts as soon as you get into contact with the patient. The general survey encounter, you launch a general survey the moment you first encounter the person. You're going to look at the immediate impression. This person stand promptly as his or her name is called and walk easily to meet you. You look at if they're looking sick, if they are rising slowly or with effort, with shoulders slumped and eyes without luster or downcast, conversing without difficulty, reading, looking at television, or lying perfectly still. Introduce yourself and shake hands. You are collecting data. Does the person fully extend the arm? Shake your hand firmly. Make eye contact or smile. Are palms dry or wet and clammy? Throughout health history measurements and vital signs, make note of points that will add up to the general survey. Consider these 4 areas: their physical appearance, body structure, mobility, and behavior. Is this subjective or objective data? Objective data is going to be their physical appearance. Each person looks or appears his or her stated age, sex, sexual development appropriate for gender and age, level of consciousness. Person alert, oriented, attends to your questions, and responds appropriately. Skin color, whether the color tone is even, pigmentation varying with genetic background, skin intact and with no obvious lesions. Facial features, is it symmetric with movement? No signs of acute distress present. Body structure. The stature, height appears within normal range for age and genetic heritage. Nutrition, weight appears within normal range for height and body build. Body fat distribution is even. Symmetry, body parts look equal bilaterally and are in relative proportion. Posture, person stands comfortably, erect as appropriate for age. Exceptions, you have the aging person who may be stooped with kyphosis. Position, the person sits comfortably in chair or on bed or examining table. Arms relaxed at sides, head turned to examiner. Body build, contour, proportions are correct. Arm span, fingertip to fingertip equals height. Body length from crown to pubis roughly equal to length from pubis to sole. Obvious physical deformities. Note any congenital or acquired effects. Objective data, mobility, gait. Normally base is as wide as shoulder width. Foot placement, accurate, walk smooth, even, well balanced. and associated movements such as symmetry, arm swing are present. Range of motion. Note full mobility for each joint, and that movement is deliberate, accurate, smooth, and coordinated. No involuntary movement. Facial expression. Person maintains eye contact unless a cultural taboo exists. Expressions appropriate to situation, thoughtful, serious, or smiling. Note expressions both while face is at rest and while person is talking. Mode and effects. Persons comfortable and cooperative with examiner and interacts pleasantly. Speech is articulation is good, ability to form words clear and understandable. Stream of talking is fluent with an even pace, conveys ideas clearly. Word choice appropriate to culture and education. Person communicates in prevailing language easily by himself or herself or with interpreter. Dress appropriate to climate, looks clean and fits body and is appropriate to person's culture and age group. For example, whatever is normal for that culture. Amish women, they wear clothing from the 19th century. Indian women may wear a sari. Culturally determined dress should not be labeled as bizarre by Western standards or by adult expectations. Personal hygiene. A person appears clean and groomed appropriately for his or her age, occupation, social economic group.